Hi, my name is Cynthia Squires. I'm 15 years old. This is my 6th year in Poultry Showmanship and my 8th year in 4-H, and I'm part of the Barnyard Gang 4-H Club. And this is my red blue-laced Wyandotte Tiny. The red blue-laced Wyandotte was developed in the mid-1800s by crossing a red Wyandotte with a blue-laced Wyandotte. Although it is unknown of its exact origins, it's suspected to be from either New York State or from Wisconsin. However, we do not currently know where it came from exactly. This breed is a dual-purpose breed, meaning that it is used for both egg production as well as for its meat production. Do you have any questions, or would you like me to continue? Today, I'll be checking my bird for any signs of parasites, damage, disease, and deformities. Starting with the beak. I'm going to be checking the beak for any signs of cracking and chipping, as well as for any deformities such as scissor beak. As you can see, his beak is clear. Any sort of damage or deformity to the beak can cause malnutrition in the bird. Scissor beak, which is a common deformity, happens when the bird is in embryo, and there is no way to fix it, unfortunately. Now I'll be checking for correct color of eye, as well as any cloudy spots or cloudy sheen over the eye. Correct color of eye is important because if there's any other color, such as a yellowish sheen over the eye, as well as gray, browning, and blacking of the eye, can be a sign of a virus known as Merrick's disease, which is terminal. Cloudy spots or cloudy sheen over the eye can be a sign of blindness. As you can see, both of his eyes are clear, and he is alert. I'll also be checking his comb and wattles. I'll be checking for any damage to the comb, sex identification, as well as comb type. He does not appear to have any damage to his comb or wattles. As you can see, this bird is a male. With its larger comb and wattles, as well as more vibrantly colored compared to its female counterpart, we consider this one a male. Lastly, its comb type is rose comb, which is typical for its breed. I'll now be checking the wings. I'll be checking the wings for any signs of damage, as well as correct number of feathers and any parasites that live underneath. As you can see, he does have some damage sustained to his wing. This is common as he is almost 2 years old now. For the primary flight feathers, he should have 10 to 12, 1 axial feather, and 14 to 16 secondary feathers. I'll now check underneath to check for any parasites such as lice. He's clear of any such parasite. I'll do the same to his other wing. As you can see, he has also sustained some damage to his wing. This is normal as he is a little bit older. He should have 10 to 12, again, he should have 10 to 12 primary flight feathers, 1 axial feather, and 14 to 16 secondary flight feathers. And he does not appear to have any lice underneath the wings. I'll now be checking depth and width of body. If this rooster was a female, the depth and width of body would be important because it shows us if the hen is able to support a laying egg. This is his depth. And this is his width. Considering he is extremely narrow, it is unlikely he'd be able to support an egg if he was a hen. I'll now be checking the keel bone. The keel bone, also known as the breastbone or sternum, can become deformed and crooked from a condition known as rickets. This is a vitamin deficiency in vitamin A, C, D, as well as phosphorus and calcium. As you can see, his keel bone is straight. I'll also be checking his legs for straightness of legs, as well as for any parasites and correct number of toes. As you can see, his legs are straight, are smooth, and only have 4 toes. Smooth legs are important because if they were to be scaly, that would be a common sign of a parasite known as mites. For this breed, they are only allotted to have 4 toes, which he has. And his legs are straight, meaning no deformities. I will now do the same on the other side. He's clear of any deformities as well as any signs of parasites. I'll now be checking the uropygeal gland. The uropygeal gland, also known as the preen gland, is a common area for lice to be able to breed. It is a warm, dark environment and is used for the bird to reach back and get oil on its beak to preen his feathers. As you can see, there's his preen gland. And it is free of any signs of parasites. Lastly, I'll be checking his vent and pubic bones. I'll be checking his vent for any signs of discolored discharge, such as a runny white or a bright lime green color. A runny white discharge can be a sign of a parasitic disease known as coccidiosis, which is a parasite that lines the inside of the stomach and causes malnutrition. His vented area is clear. I'll also be checking for any signs of parasites above and around the vented area, such as lice. His vent appears clear. Lastly, I'm going to check the pubic bones. The pubic bones is important to check, especially if he was a hen, to check if he would be able to pass a laying egg if it was a female. I can only fit 1 finger between his pubic bones, meaning that he is most likely 1, a male, and 2, that he would not be able to pass an egg if it was a hen. What's wrong with your leg? My name is Cynthia Squires, and this is my red blue lace Wyandotte Tiny. Do you have any questions?